That's a beautiful song, eh, boy? I wonder if I could write a song like that, boy. Hey, studio, well, you don't have confidence in me, you know. All right? I'll have to put pen to paper. All right? And let's see what happens. But boy, that's a beautiful song. So today is World Lupus Day. We do have with us now President of the Voice of Lupus Foundation, REEANNA HARRILAL. REEANNA, good morning.
Hi, good morning.
Yes. REEANNA, well, let's get right into it. REEANNA, how serious is the situation when it comes to persons inflicted with lupus in Trinidad and Tobago?
Well, lupus is a chronic autoimmune disease, and when you hear the word lupus, not many people know what lupus is. So it's an autoimmune disease. It's not a type of cancer, nor is it a blood disease or a skin disease, or it's certainly not HIV and AIDS related. It's an autoimmune disease, and the immune system is meant to protect the body from viruses and bacteria. When you have lupus, your immune system essentially wages war against all healthy organs, tissues, and cells. So no two lupus patients are alike, and they might be similar in terms of the symptoms, but it all depends on how the disease is affecting them. So many lupus patients go into renal failure, many go into multiple organ failure, because the disease attacks all the organs, all the systems in the body. And there is need for a multidisciplinary approach to dealing with lupus, treating lupus. And in Trinidad and Tobago, I believe that the lupus community, we are medical orphans. Since the pandemic, we have been struggling, the lupus community have been struggling to get even some of the medication, for instance, hydroxychloroquine. During the pandemic in 2020, the Voice of Lupus Foundation was at the helm of lobbying the government to ensure that there was an adequate supply against global shortages, and even persons hoarding the medication as a potential cure for COVID. Up to this day, we still have an issue with the supply of hydroxychloroquine at the nation's hospitals. Now, our medications are not available on CDAP. So many patients are at the mercy of having to go privately. The medications are very expensive. Not every lupus patient might, have access to, health insurance and all those sorts of things, and many of our community members, they are living on either public assistance or disability, because being diagnosed with the illness, they aren't able to hold down a permanent job. They're not able to work because of the disease activity and what have you. Because when you look at the symptoms of lupus, it's joint pain, fever, hair loss, fatigue, chronic pain. And then when major organs are involved, many patients are left, basically disabled. And lupus is one of those diseases that it's an invisible disability. Remember, not all disabilities can be seen. And the Voice of Lupus Foundation today, it's the theme is Go Purple, to make lupus visible, because most times the symptoms of lupus are not always visible, but lupus patients are not invisible. And we need to continue the advocacy and the campaigns to help bolster the very much needed awareness and sensitivity when dealing with lupus. And, I mentioned medical orphans. There needs to be a very strong medical and multidisciplinary approach when dealing with a lupus patient, especially systemic lupus. And the organization has been at the helm for the last 13 years, just raising that awareness and trying to, improve the quality of lives and the outcome, because there are so many lupus patients who, unfortunately, they lose the battle to lupus.
But REEANNA, how much patients are we speaking about?
So
do we have data, the numbers?
Right. So there is no official data available in Trinidad and Tobago, not even in the Caribbean region. However, for the last 13 years, the Voice of Lupus Foundation, we set up our own internal patient registry. At one time, it was over 1,500. Of course, during the pandemic and stuff, we lost a lot of our lupus patients. That number has gone down to about, I think, 1,100 in the last 3 years. I remember in 2016, Dr. Coniet would have led a research or a survey, and at the San Fernando General Hospital, the lupus clinic there, the rheumatology clinic, there was, I think it was 169 patients, but 91 of those patients tested positive for lupus. And that's just since the SWRHA San Fernando Lupus Clinic. There are lupus clinics throughout Trinidad and Tobago. So it's a very inaccurate statistic in terms of, letting you know in terms of the population, just how many lupus patients are in this country. I mean, I know that there are hundreds and there are thousands of Trinbagonians living with lupus. Lupus is one of those illnesses that you just hear the name, but, most times people don't really understand because it takes such a long time to diagnose, and then lupus is the great imitator. It mimics so many other diseases out there. So by the time, do you know, Marlon, that it takes approximately 6 years to get a confirmed diagnosis from the time you start showing symptoms of the disease?
And what are the symptoms? What are the symptoms, and what's the reason why it takes so long?
So because lupus mimics and imitates so many other diseases out there, most of the time in terms of testing, there is no one blood test that can confirm a diagnosis of lupus. First of all, you have to meet the criteria. The criteria involves meeting at least 4 out of 11 symptoms. The symptoms are fever, joint pain, hair loss, photosensitivity. Sometimes you may have something called a mylar rash, which is a rash that spreads from the bridge of the nose onto the cheek. Not every patient has that. I never had that in my diagnosis with systemic lupus, but that's one characteristic. There's also depression, there's headache, dried eyes, photosensitivity. I mentioned that. That's basically you have a reaction to being out in the sun, exposure to UV lights, that sort of thing. Then there's the main symptoms when major organs are involved. There 85% of persons living with systemic lupus at one stage end up, in renal failure, something called lupus nephritis, which is basically inflammation of the kidneys, and that is, not always a good outcome. I mean, we have I'm a former journalist, but we have a former colleague in the media, Natalie Legault, who has been a trooper in terms of battling lupus nephritis, So the disease is very complex, and it takes so long in terms of ruling out what it's not before you reach to the root of what it is, because of the antibody testings. You have to be screened so thoroughly, and there's so many different types of blood work that's involved. So it's a lengthy process, and we're really hoping that through the Voice of Lupus Foundation's Lupus Learning Resource Center, that we can now approach this in a multidisciplinary way, where we can now test faster and we're able to treat lupus patients in a spot, as opposed to they're spread across the country in different hospitals. Many lupus patients, I remember at one time I was in 6 different clinics, and because it affected different parts of my body. So I would have had to go cardiology, nephrology. I would have had to go to the rheumatologist. Then I was in dermatology, gynecology, those sorts of things.
So there's need for, let's say, a one-stop shop.
Basically, yes, there's very much that demand, and that's what we're trying to do as an NGO, to bridge that gap and also to provide a better quality of treatment and life, to extend the life of persons living with lupus. It's very sad. A lot of lupus patients, unfortunately go into multiple organ failure. And then when you don't have access to the medication, as I was mentioning, the hydroxychloroquine issue, that's one of the drugs. It's an anti-malarial drug, but it's used to treat persons with systemic lupus, those with rheumatoid arthritis. And when there is an interruption in the treatment, because a lot of patients have to be skimming back, you have to take 2 pills a day, you're doing 1, sometimes you're doing half of a pill, because the access and the availability is not always there. Not everyone can go privately and purchase the medications, So we also sell it at wholesale, so that way it's not at the cost that the pharmacies are doing privately, because patients are paying up to $9 and $10 for 1 pill, and it's too expensive.
Is there any particular group that is most affected?
Well, I would say, it's known that lupus is called a woman's disease, because 9 out of 10 are women who are diagnosed with lupus, but men also get lupus. Also, we have found, and I mean, even with the Lupus Foundation of America, when they research, there are over 5 million plus people living with lupus. They have isolated those of the Afro-Americans, as well as more persons of Asian descent, and of course the East Indian and the Afro descendants. They are the ones who are mostly susceptible to developing, but genetic also plays a factor, and that's something that we need to talk about. There is, there's no known cause for lupus, but scientists have trickled it down to three. It's environmental, stress, and genetics. And they are thinking that, and of course there's some dialogue around women, around the hormones and how it affects us, because when you look at the testing for lupus back in the last 15-20 years, it was women of childbearing age, so persons between 15 and 44 were the ones being diagnosed with lupus. But now we have seen in the last maybe about 12 years, you are getting younger persons as young as 3 and 5 year old. I think we have like 2 5-year-olds living with lupus nephritis right now. We lost a young boy last year. He was 9 years old, getting ready to write SEA, and he passed away because complications of lupus, and he also went into renal failure. So it's a very sad thing, and today is a very significant day for the Voice of Lupus Foundation. The theme is Go Purple, to make lupus visible, because the symptoms of lupus are not always visible, but those who live with lupus are not invisible, and we need to continue raising awareness, continue the dialogue. And of course, it's also a very significant milestone for the organization, Marlon. I'm a South girl, by birth, and it's a great privilege to announce that the mayor of San Fernando, Junior Regrello, His Worship, will be doing an official proclamation of World Lupus Day. And that's a historic move for Trinidad and Tobago and the entire Caribbean region. Government leaders around the world today are issuing proclamations declaring May 10th as World Lupus Day and calling for more research on lupus, greater public awareness of lupus symptoms, and of course support services for those affected by the disease. So it's a milestone. I've labored, I've worked very hard for 13 years, and today we're doing this proclamation, and it's a very huge milestone for the organization to be at the helm of this, to achieve this today on the city of San Fernando, most importantly for me, because being a daughter of San Fernando and also living with lupus, and the center, the Lupus Learning Resource Center, is based in South. It's really a milestone for us, and we really feel very happy, and we really thank the mayor. We're also hosting that Public Information Day and Health Fair this afternoon from 1 till 5. Then we lead a silent procession up to Harris Promenade, where we light our candles for those who would have lost the battle. And the city corporation's building will be turned purple, their lights, so that we can raise awareness and stuff. So it's a wonderful day. We're inviting members of the public. For those of you who have not left home yet, please put on something purple. Put on purple, and let's just get the awareness going and share the information. You can follow us on social media and reach out. Come on down to the Library Corner, the infamous Library Corner, the meeting spot. The year's gone by. So come meet with us, learn about lupus. The SWRHA will be there providing various multidisciplinary approaches to talking about lupus. I know we will have the rheumatology department, the nephrology, medical social worker, because that's a conversation we need to have as well. A lot of lupus patients really battle with mental illness, depression and anxiety surrounding the illness, as well as lack of treatment. Because when patients, and I'm at the helm of it, when I'm getting calls almost every day, Ms. Harrilal, I don't have hydroxychloroquine, I'm not getting it in the hospital. Does anyone know where we can get it? Patients are leaving from Point, going up to all the way to Sandy Grande, to St. James, to Port of Spain, to Mount Hope, trying to get it. I'm at the Mount Hope Clinic. I cannot tell you when last I got my prescription filled.
Yeah. REEANNA, as we come to the end of this discussion, what's your message to persons who have been inflicted by this disease?
You may have lupus, but lupus doesn't have you. Someone have lupus, and you have to be kind. How can you say you don't have lupus if you don't know what it is? And education is important. So I thank you so much, Marlon, for facilitating this interview. Yeah.
REEANNA HARRILAL, thank you very much for speaking with us this morning. You have given us a lot of food for thought, and I hope that it's a very serious disease, and you all get the help that you desperately need, because I think it's a dire situation. So thank you very much again.
Thank you.
Yeah, and a special good morning to my friend Natalie Legore. She's a very strong lady. All right, so it's time for another break with a live update at the Eddie Hart grounds.